Hello everyone, here's Dr. R. Today we're going to talk about 5 fundamental tips for a healthy smile. Tip number 1, brush regularly. You should brush after every meal, or at least twice a day, morning and night, to make sure you disorganize the plaque. At night it's good to disorganize the plaque before you go to sleep. When you sleep, it's actually because of the humidity, the temperature, is a perfect environment for bacteria to multiply. That's why you should brush in the morning as well, to make sure you disrupt that plaque. A lot of people ask about what type of toothpaste I should use, what type of toothbrush should I use. What's proven by serious research that the most important thing about brushing is really the mechanical breakdown of plaque. Problems from decay and gum disease comes from plaque that organize, that becomes stronger together and multiply to a type of bacteria that will cause more damage, being to your teeth or being to your gums. On that note, I always recommend the electrical toothbrush. Sonicare, the sonic toothbrush tends to be the best one out there. I have tried many different ones, and this is the one that it's proven to remove more plaque, okay? So it's not that you must have one, but if you can, it definitely should be your best option. Tip number 2, floss. Brushing will only clean so much of the teeth surface. Flossing will help to clean in between the teeth, okay? What is shown is that the consistency of the habit is what is important. So you should floss every day, at least once. If you can do twice, that will be perfect, okay? Flossing is responsible for cleaning 35% of the surface of the teeth. So that means if you don't floss at all, you're pretty much leaving about 10 teeth without being clean at all. That's what it accounts for 35% of the surfaces. For the patients that do have gum disease, an additional tool that is very helpful is the water pick or any other brand. It's pretty much a device that will shoot water between the teeth and the gum that will help to flush everything out. That tends to be very helpful for patients with gum disease. Tip number 3, use a mouthwash. Mouthwash will help to fight bacteria in your mouth, okay? Alcohol, non-alcohol, whatever you prefer. Again, it's about the consistency of habits. What I prefer to use the non-alcohol ones. Tip number 4, regular dental visits, professional cleaning. Every patient should have a cleaning every 6 months at least. That means twice a year. For patients that do have gum disease, that recall schedule needs to be more close. That means they need to be seen every 3 to 4 months. What research shows is that patients that have gum disease, that have been through treatment, being that surgical or non-surgical treatment, the ones that have their cleaning every 3 or 4 months shows a much lower incidence of recurrence than the ones that have had every 6 months or once a year or even worse than that. I always tell my patients that have severe dental problems, a lot of times they get there because of neglect. Life gets into the way of everything. If you're committed to do your treatment, as important as doing the treatment is maintaining afterwards. And that will be having a cleaning every 3 or 4 months and being checked by your periodontist once a year and your regular dentist once a year as well. Tip number 5, avoid sugar. Opt for fruits, vegetables, and calcium. They'll help to keep your teeth healthy. So I hope all this putting all together will help you to keep a healthy smile.